Well, welcome to another Wednesday Wellness, and we're so excited to have our friend Ryan Poplaski from Bodywise Physical Therapy back with us again. Today we'll be discussing hip health. So Ryan, take it away.
Thank you, Perla. Like Perla said, I'm Ryan from Bodywise Physical Therapy in Epping. We've been in Epping for the last 14 years. We're going into our 15th year, which is exciting. I've been a physical therapist for about 20 years now, and I love helping people with back pain get back to their normal lives again. That's something that I enjoy doing, and we're going to talk a little bit about that today in some ways. And even though this is a topic about the hip, the back definitely comes in play because of how close it is. And it's surprising how many people think they have hip pain when in reality they have back pain. And vice versa to that, people with back pain actually can have it referred up from the hip or caused by the hip in general. And we'll touch a little bit about that. And I really want to let you guys know if you have questions or ideas, or even if you want to make a comment, just don't be afraid to interrupt me at any time, and we can talk about whatever you like at that point in time. I do have a few slides, so if I could screen share, have that ability to screen share, I'll move to that, because in reality, it's going to be more interesting looking at exercises and potentially some videos than my mug moving forward. So, but we will get moving as soon as I can do some screen share. All right, can everyone see that? Yes, all right. This little bit here, trying to get back in shape, that is what we do. We help you exercise through injury. And I really do believe that you can continue to exercise through any injury. We have someone recently that had a Achilles tendon rupture and surgery, and we encouraged them to continue to exercise. There's a lot of stuff they can do. They're doing upper body stuff. They're doing stuff on the rowing machine. There's a lot of stuff you can do. So don't stop because you're injured. You need to continue to work out. You need to continue to train. It just has to be modified. And being a part of Fit Body helps you do that. Fit Body will work with you and will modify exercises. They're famous for that type of thing. And that's what they do best. So talk with your trainer if you do have an injury and let them help you modify to continue to exercise, because that's only going to get you better faster. All right, let's get into the hip stuff. We'll get it right into the most exciting stuff, which is the anatomy. These are some of the muscles of the hip. If you can see that there's a lot of different muscles, and the muscles I want you to really look at are the muscles at the hip here that go up and attach up into the spine. And people don't realize that how much your hip flexors, and you can hear me say that a bit, and even your hip adductors play an important part in the rotation of your ilium here, or your hip, your upper hip portion there, and how that plays into the spine. So stuff that occurs at the joint itself, tightnesses, muscle imbalances, muscle weaknesses, can affect your low back very easily. And the two really compensate for each other. So think about that when we're kind of going through some of this stuff. The hip joint without the muscles looks like this. And this is a cross section of that. So you have the ball and socket joint. Everyone knows these days what a ball and socket joint looks like. But I want you to really look at how close those two bones are within that joint. Now you can see there's not a lot of space there. And there's a reason for that, because you don't want your hip to be dislocated when you move it. It's a very tight fit. And when they do hip replacements and they replace this bit, that ball and socket that they create is also very tight. And if it's not, it pops out very frequently. But they test that all in surgery. But even though it's tight, you want to look at how close the two bones are together, and know that because of that tightness, you have decreased range of motion at the extreme. So you don't have a lot of motion, say, into extension before you hit bone to bone. You don't have a lot of motion a lot of times into flexion or out to the side in abduction until you hit bone on bone. So if you have arthritis, or if you have disturbances within the hip joint, that range of motion is decreased, because your chance of going bone to bone is a lot higher. So you want to keep your movements a little bit less at the extremes at that point in time. So we're not looking to have you do splits or anything like that, but more to keep that bone from hitting that other bone. There's ligaments that surround that to keep it nice and tight. And then the muscles play an important part in that. Now, we can get right into some of the exercises here. And I'm going to give you a few quick exercises to do to help keep your hip mobility up, which will only help keep your hip healthy. And it'll also help you get prepared for working out as well. So the first few are warm-up exercises, easy to do, and a great place to start before you do any stretches, before any exercises. And this is meant for everyone, because if your hip is tight, you can't squat very far. If you can't squat very far, then you're not going to get the most out of your exercises. If your hip is painful or your back is painful, you want to stretch out the muscles that are tight, which are limiting the motion at the hip, which then which then causes back pain because the back has to compensate. Or if your back is injured, you want to make sure your hip has full mobility to take pressure off the back. So vice versa. So this first one is really just a warm-up exercise. I'll let you guys kind of watch it. And just little range of motion exercises. Now she looks like she's in her early 20s. And you got to remember back to that hip diagram. So her range of motion is going to be a lot different than my range of motion, or maybe your range of motion. So think about that when you're exercising. You don't have to copy this, but you do have to do a variation of that. It doesn't have to be perfect. It can be a modification of that where it's a little bit less. But see how she's opening up her hip, just creating some movement. And the reason why you want to create movement is it helps, yes, loosen up the muscles. It helps loosen up the ligaments. But more importantly than all of those things is the fact that you are creating movement of the fluid within the joint. And we call that a nutrition of the joint in a way, but it really is. It's just you're warming up the joint itself, and you're letting the fluid flow through that joint a little bit easier. And that's a great place to start. Here's another good exercise. It's done in the pool, but you can absolutely do this outside. In fact, this is the #1 exercise I recommend to patients who have hip pain to take care of some of that discomfort. We give this to patients who've had hip surgery. And you can see, again, this is a big range of motion, big circle. And I would start off with small little circles that get into a little bit bigger circles. Now, this should all occur at the hip. You don't want to make your back move too much with this because you really want to isolate out that hip. And if you start to compensate by moving your back, or you're rotating your trunk too much, then you're only adding to compensation while you're exercise. So you really want to isolate out to just the hip so the upper trunk doesn't move much at all. And again, sitting, doing little motions like this. Sitting is the worst thing for hips. It's what causes hip pain. It causes hip flexor tightness. It increases pain for people with back and hip issues. And we sit all day long. We're sitting right now. We sit for work. We sit in the car. We sit watching TV. Think of how much time we sit, and we have to counteract that by exercising. We have to counteract that throughout the day. And this little exercise here, this warm-up exercise here, is a great bit to start to warm up that hip, to get that fluid motion moving a little bit. So again, one more time, it's just up and down, doing this 10, 20 times once an hour if you're sitting at work, or if you have pain, anytime you have pain, doing this in the car at the stoplight or something like that. All those things will help decrease pain over the long run. Now, getting into the stretch, kind of a weird picture here, and I'll start the video. But this stretch is for your hip flexors. And, well, I guess this stretch is for your hip, your glutes and such. I'll show you another one for your hip flexors. This one right here will help with decreasing pain in the piriformis muscle, which is one of the muscles in the back side of the hip. And it's a very good exercise, very good stretch. Easy to do. And all the stretches that I'm giving you today can be done in a chair. I've really made it easy for people to do these. You don't have to lay down on your floor at work or at home. You can do this from a chair. And this is a great way to stretch that out. You know, people talk about hip pain. A lot of it has to do with the hip flexors, and he's pushing his knee down and also leaning forward. By pushing the knee down, you're stretching out those hip flexors a bit. Here's another hip flexor stretch that I like. Again, it's not laying on the ground, which can be done, but she's just leaning in and she's actually stretching out her glutes on her right side and her hip flexors on her left side. Now, she's not leaning forward, but she's also not arching her back too much. And that keeps a neutral spine position and really helps her stretch out that hip flexor. If she really wanted a good stretch, she'd hold for 15 to 20 seconds, you know, opposed to going back and forth like that. But that's another good way to warm up the hip. When you're doing these stretches, when you're doing these exercises, there should be no sharp pain at the hip. It should feel like a stretch. It should never feel more than that. If you are getting a sharp pain at the hip or something that does not feel like a stretch, think back to what that hip joint looks like. And most likely you're getting pain from the fact that you're pushing two bones together because it's such a tight area. So until your hip starts to loosen up a little bit and you become a little bit more flexible, you should limit your range of motion in that sense. Does that make sense? All right, good. Now, your adductors, the muscles on the inside of your thigh. This is a great stretch for those. And if you remember from that very first picture I showed you, those adductors and hip flexors play an important part in what the back does. So people with back pain a lot of times have hip pain, and people with hip pain a lot of times have back pain. The two go hand in hand because the muscles are connected to both areas. And he should stretch for a little bit longer than what he's doing, but it's a quick exercise shown. And he's stretching his left side for those of you who are wondering. All right, here's another piriformis stretch. Right here, she's stretching out her glutes, and that piriformis is the muscle that goes between your sacrum and your hip joint, and it plays a part in the sciatic nerve. And people have heard of sciatica in the past, and the sciatic nerve can be impinged at the low back, which is most frequently that happens, but also can be impinged within the muscle of the glute and the backside of the hip. If that's the case, you only have pain in the buttock and kind of mid hamstring. If it's impinged at the back, you have pain that goes down to your foot. So it's one quick way to determine where it's impinged. And if it's just in the buttock, this is a great stretch for it. But if it goes all the way down to your foot, then you're going to have to look at something else. So it's a great sitting stretch for the hip. Let's see, did I go through all of them? I believe I did. I think that's that. I'm going to stop the share here and go back to me here. So with that, does anyone have any questions about the hip joint and hip stretches? The one thing I want to tell you is that, a lot of people talk about where their pain is coming from and they point to the hip. And sometimes that pain can be coming from the back. It can be referred down to the hip, or vice versa. They point to the back side of their hip and they say, oh, I'm having hip pain. But in reality, that pain is most likely coming from the back. True hip pain, true hip joint pain occurs when you have groin pain and pain off to the side of the hip, opposed to just in one area. You can have pain off to the side of the hip. You can have clicking at the hip. All that is hip pain specifically, but you really should have it looked at to see where it's coming from specifically, if it's a low back issue or if it's a hip issue. And as physical therapists, we can quickly determine that and set you on some good exercises moving forwards. But the one thing, if you want to take from this lecture, is the fact that you really need to stretch and warm up the hip. Stretching the hip flexors specifically. We all have very tight hip flexors. That's why with your functional movement screens, they can't squat as much, they can't reach as much, is being most of the time because of those hip flexors. Or tight adductors, that other stretch we showed you, when they squat, their feet